Welcome back to Scissors and Scrubs. I'm Nicole.
I'm Laura.
This week, so we have a girlfriend who loves to send us all kinds of shit.
Yeah.
And
all kinds of shit.
All kinds of shit. And one of the kinds of shit she sent us was the case of Rachel Tussey, the TikTok influencer, which if you do not know it, we are going to discuss in this lovely episode. Mm-hmm. Do we have anything else we need to discuss for the season of spring, Laura, before we get into Rachel?
I don't think
Do we have anything we want to talk about? No. Sun's coming out. It's getting
like
warmer.
The weather's nice.
My flowers are out.
Yeah, everything's
It's been a long winter.
All the trees are pink and white, and they're so pretty.
It's been a terrible winter.
It was terrible.
It better be a good summer to make up for it.
Yeah.
The guy that I bought a refrigerator from a guy today. Oh, he was a character and a half. And, being a nurse is not always, like, I'm looking at him like, oh, he's had a trach. He's had a head injury. The eye's off. That's why he's talking. And I'm like, I don't even know what he was saying half the time. And he's like, I hate New England. I fucking hate New England. I'm leaving. And I'm like, oh, he's moved to Florida.
Ugh.
And I'm like, really? You think that's better? It's like the most random state because it's either trailer park or high-end Beverly Hills. There's no in between in Florida.
Even those people that live in the high-end Beverly Hills, I think they're still trailer park.
I know, but there's a lot of it's just such a random state. And he's going to
It's a fucking swamp.
Yes, and he's going like Tampa. Tampa's such a vanilla city. There's like no character down there. So do I love our winters? No. Do I hate the weather most of the time? Yes. But we have character. I'm never leaving.
No, I told you that. I'm here.
I mean, I'm going to leave for months to get rid of the winter, but I'm never leaving the actual
travel.
Yes, out of the winter. But I'm never leaving New England. Okay.
I also think you don't appreciate
what you got till it's gone.
And when those little buds start, the joy in my heart.
Well, I was saying that to some, like, if you live in a state where you don't get the 4 seasons, you don't understand the way people look for the seasons. Like, I will walk out in the winter and you can look up at this guy and you're like, oh, it's going to snow. You can smell it. Or you can look at the trees and you're like, oh, fall's like, you can tell the color of the leaves of the trees before they churn that fall is coming in like a week. And then in the spring, when spring is coming, you look at the end of February, you start seeing the shoots coming out of the ground, the trees are budding, and then like overnight the trees pop. It's exciting. It is exciting.
It literally makes you like, so.
Spring makes me that way. Fall makes me sad.
I like the fall though.
I love fall, but when you're sitting out in an 80-degree day and you're like, oh, there's not going to be many more of these.
I gotta hang on to this till May.
Whereas like now when you get an 80-degree day, you're like, oh, it's coming. Yeah. It's coming. Yeah. All right. So poor Rachel Tussey. Holy shit. This was a tough case. Well, let me tell you, I got my information. So a lot of this information is off of TikTok because that's where the information is. So there is a TikToker called the Legal NP that she does like a 3 or 4 part thing on it. The husband put out a statement and I tried to fact check with Chicago and NBC. They've done a couple of articles on it. So you cannot hold me to factual content on this because it's coming off of TikTok.
It did happen.
It's just all in litigation. It's a very recent event that has happened. There's a lot of allegations going around. So I'm going to tell the story the best way that I can and just know that I am not a reporter. So I did the best I could with information to make sure it was correct. Okay, so Rachel Tussey is 47 years old and she herself is a chronic TikTok poster, influencer. I don't know what makes you an influencer if you just put out multiple videos or what is she influencing? I don't know. But she was talking for months about her mummy makeover, which we're going to get into. We're going to have you talk about that in about 2 seconds. She's adorable. I don't know why she felt she needed this to begin with, but whatever. So she was deciding she wanted to get a mummy makeover. So I'm going to have you talk about mummy makeover real quick before we get into this.
All right. A mummy makeover is a series of cosmetic surgeries that help reshape some of your physical features after giving birth to these wonderful children. The most popular procedures in a mummy makeover are a tummy tuck. And you get a tummy tuck because during pregnancy, your belly, both your skin and the underlying structures stretch to accommodate that lovely growing child.
And they never go back.
They open following your pregnancy. Your tummy area may feel looser than before. Don't look down.
No matter how hard you work, it'll never go back.
And if you're uncomfortable with how that looks, a tummy tuck can help remove the excess skin around your abdomen and tighten your abdominal muscles. And it may even improve or remove stretch marks and C-section scars. Usually the excess is a combination of fat and skin, and the optimal procedure may be a lipo-abdominoplasty, which you do liposuction and have that excess skin removed. So it enhances the contouring. Another procedure often done in a mummy makeover is a breast augmentation, reduction, or lift.
I'd like a nice lift.
Yeah. A breast augmentation, if your breasts have lost volume, implants can make them look fuller, and augmentation is usually when you put an implant in. The deflated appearance after pregnancy, make them appear saggy, but it's really, you've just lost volume. A breast reduction you would get if they're larger than before pregnancy, or they're making you uncomfortable or causing back pain, so they can remove some tissue and reshape them. Or you can get a breast lift, and you would do that if they're sagging, but you don't want them bigger. A surgical breast lift can help raise them by removing the extra skin and tightening the breast tissue you have. Yeah.
I would like to have that.
And combining the augmentation with the lift is extremely popular. A lot of people do that. They'll put an implant and then have everything lifted. It gives them where they should be and more volume. Another part of the mummy makeover is often liposuction. It works best for like localized fat deposits. So if the main concern is fat and there isn't much skin, like if you don't have like the sagging skin over the fat, you don't need the tummy tuck, you just need the liposuction. Or if you get it on like thighs, the outside of your hips or that outside of your thigh little area, so you can have liposuction to help contour everything. Another procedure, which I didn't realize was part of the mummy makeover, is a labiaplasty.
I was going to say it has to do with the vagina, right?
So it's a surgical option that reduces the size of your labia minora, or the skin folds that surround your urethra and vagina.
Do they grow when you're pregnant?
Pregnancy hormones can lead to changes in that skin or that tissue. Or it could have been stretched in childbirth and it doesn't go back to the pre-pregnancy shape. When you have a lot of labial tissue, it can get pinched or tugged during exercise or sex, making that very uncomfortable and painful. And removing the extra tissue.
Since I'm not doing either. No, I'm just kidding.
Can help with comfort and appearance. So those are mostly the procedures that are done during a mummy makeover. The recovery time varies based on your age, your health, and the number of treatments you're having. For most cases, you can go home right away. And surgeons recommend no heavy lifting or strenuous exercise for about 4 to 6 weeks. You have to follow your doctor's orders extremely closely. Pay close attention to stitches in the areas that are affected during the surgery. You might need help around the house for the first few weeks with just your daily activities. You shouldn't go to work for a few weeks, but obviously you do what your doctor tells you to do. You have to set realistic expectations for a mummy makeover. Yes. It's not going to make you... I think
that's with any plastic.
Into Barbie suddenly. Also, you're going to have scars because scars are a natural part of healing. They will fade and they will be in new places than your old C-section scars, but you will have scars. And think about it, future children and future pregnancies can undo some of the effects of the treatment. So you might want to plan, hold off until you're completely done. If you have existing health conditions like diabetes, heart disease, you're at higher risk during surgery. So you need to take that into consideration. You need to quit smoking at least 6 weeks prior to surgery. It's linked to increased risk during surgery. It can lengthen your recovery time. You should not be smoking if you're having surgery. And make sure you are choosing a surgeon that is a certified American Board of Plastics surgeon. Certified American Board of Plastic Surgeon. Do not go to somebody that is not. But a mummy makeover, people love the results. You're not having the sagginess all around. You feel like you feel before you had themselves. Kids. Usually people are very happy with it, but everything comes with a risk.
Well, she did go with a double board certified plastic surgeon, Dr. Shahrayar Tork. Okay. And she was getting a tummy tuck. That was her mummy makeover that she was doing. And she had talked about it like constantly on her TikTok. She has pictures of her. The pictures she takes of herself are in front of the Tork Surgery Center, but that is not where this has happened. And this is very important point that she did not have it at her surgeon's surgery center. Okay. So it is to take place on February 25th. And her last...
This year.
This year.
Okay.
Her last TikTok video is taken. She's in the pre-op surgery center. She got the bouffant hat on. She's adorable. Like, I don't know if she has some kind of a scar, and so her mouth kind of quirks up on one side, but it's adorable.
Yeah, it's like endearing.
Looks so cute the way she is, and so she talks kind of like Drew Barrymore, a little lopsided. She got her glasses on, and she's nervous, but she's like, she knows she's in good hands. Pray for her. Blah 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 blah. So she goes into surgery at 7:30, and God bless this husband. He's waiting in the parking lot for this whole procedure to be done. Thank God he did. Yep, he waits in the parking lot because I don't know if. He may have missed everything if he did not, to be honest with you. So she goes into surgery at 7:30 a.m. He waits in the parking lot. He waits till 5:45 when he finally gets called that she is in the recovery room.
10 hours.
10 hours. Long time. So as he's going in, he sees Dr. Torque. And Torque's like, surgery went well. Things look good. I'm going home. She's in good hands. Blah, 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 blah. Goes in, he sees his wife. He can hear her talking to the nurses, telling them how they met, and she's groggy, but she's talking to them. And there's two nurses. There's one that's by the bedside that he's talking with, and then there's one that keeps coming in and out of the room. So the one coming in and out of the room says to Rachel, like, what's your pain level? And she just kind of mumbles. She doesn't really answer her. And she's like, because you got 0.5 of Dilaudid already and 150 of fentanyl. The husband continues talking to the nurse, looks down at his wife. She's blue. So he's like, what the fuck? So the nurse is like doing sternal rubs, which is where you take your knuckles and you rub on the sternum. It's extremely painful. And that's what you do to check like consciousness
to try to
on a
somebody
patient.
Out, yeah.
She's not responding to the sternal rubs. So the nurse goes, she grabs an ambu bag, she puts it on her face, and he's like, but there's no seal. Now, he's a construction worker, admittedly says he's just a stupid old construction worker, but he could tell that something was wrong. He's like, there's no sense of urgency here. So she doesn't have a great seal on the bag. She delivers 2 breaths. And then, like I said, according to the husband, there's no seal on that bag. So she runs and she grabs a Narcan. Now, where this second nurse went, I don't know.
Right.
But this nurse delivering the breaths, who should have probably just stayed put delivering the breaths, she runs, she leaves, she gets the Narcan. She gives her the Narcan. No results. Now, we've seen Narcan in the operating room. Sometimes when a patient is taking forever. It's like instantaneous. They come right out of it. All right. The nurse gives 3 additional breaths and she tells them to call Dr. Torque back to the surgery center. They wait till he arrives to call 911 and they give a second dose of Narcan when he arrives.
Why?
I don't know why they waited. So the ambulance finally arrives and she's taken to Bethesda North Hospital. It is determined that she suffered an anoxic brain injury due to lack of oxygen for about 6 minutes. She was without O2. She was taken off life support after 2 weeks, and she died.
Oh, my God.
So what happened? Well, there was an anesthesiologist whistleblower. He states that there had been prior warnings about this particular facility. She had it at a Journey Light facility. This is the other thing when you are having surgery. Do not go to these little strip mall fucking hole-in-the-wall places. Go to a hospital because the hospitals have support if something goes wrong. People get very complacent about surgery because it's getting so routine these days. The robots, people are so complacent that when something goes wrong, they don't know what to do. Right. And it's when they go wrong, it's ending in catastrophic events. So he has said in this particular facility that patients have been left in the PACU without anesthesia coverage. So recovery rooms in a hospital, there is an anesthesiologist that oversees, he signs patients in, he is overseeing these PACUs. It could be more than one.
Right.
The nurses are reporting to him. So if there's a problem, he comes in immediately. They did not have one at all for these patients who are recovering from surgery. The inadequate skill levels of the RNs and the PACUs and the equipment to monitor them. So we also I had heard of a facility in Boston where it's like a hotel. They have them all at the Holiday Inn. A nurse stays with them in the room while they're recovering from these massive surgical procedures. Body lifts, face lifts.
I mean, your whole airway could swell.
Yep. And the nurse stays in the Holiday Inn with them overnight.
There's not enough insurance in the world.
But you know, plenty of women were like, I'll do it. You're going to pay me that much? I'll do it. So they don't know the first thing about recovery room nursing.
No.
Do you know what I mean? You know how to call 911, but that's about it. They said a prior patient had a compromised airway and there was no anesthesia staff on duty. So, on this particular day, the anesthesia staff on the day of Rachel's surgery left 30 minutes after she arrived in the PACU.
That is not enough to even be out of stage 2.
Right. So she gets to the PACU. They call him in. They're already gone. I think it was less than 30 minutes because I don't know how long she was in there before they called the husband, but they were already gone when the husband gets there. All the meds that Rachel received are to be administered under the care of anesthesia. The fentanyl, the Dilaudid, which is a high painkiller. You're supposed to be doing them with either an MD or a CRNA, which is CRNA is Certified Registered Nurse Anesthetist. We talk about it in another episode. When Dr. Tork arrives, it's stated that an anesthesia provider approached him stating that they shouldn't have left and it wouldn't have happened if they had been there. And it's alleged that Journey Light's nursing staff, so what they're thinking happened is that they liked to snow their patients because they didn't want to work at night. So 5:30, the plan was she was going to stay overnight at this facility till the morning. They snow them, which I said that to my husband. He's like, what does that mean? I'm like, he didn't know what crump meant either. He thought I had the word wrong. He's like, it's only old nurses that say that. I'm like, no, crump is a thing.
Yeah.
So snowing a patient is high doses of drugs that are going to make them sleep because they don't want to deal with them. You know, they don't want to hear I'm in pain. Mm-hmm. They don't want to hear I'm uncomfortable. Can you do this? Can you do that? In our facility, sometimes we have patients who have PACU wait list. We get these PACU, and the patient's stuck in the room with us forever. Mm-hmm. And countless times I've gone in a room, and they're already 2 hours into the PACU wait list, and the patient's on a stretcher, and they're complaining. My back hurts. I get a PACU bed, which is a full-size regular bed. I put them on the bed. I give them some warm blankets. I turn the lights down. I put music on. They're out like a light. Right. I don't need to give them Dilaudid and fentanyl. Just to give them a little fucking TLC.
Right.
Okay, so it's alleged that the nursing staff administered a rapid overdose of opioids, far exceeding what she had received during the 9-hour surgery.
Right. I mean, she already had stuff on board. Yeah.
Causing respiratory failure, anoxic brain injury resulting in death. That's what they are theorizing they had. Some believe that she may have developed a wooden chest syndrome, which is a rare life-threatening symptom caused by a rapid infusion of fentanyl. It's when the body becomes so rigid it is impossible to ventilate. So Dr. Tork, God bless this poor guy. This is not a result of what he did.
Right, his surgery was fine.
He did his surgery textbook. And he's like, one of the TikToks that popped up is an interview with him. He's talking to the press. He's in tears over this case.
Must feel
He's
awful.
In tears. Yeah. He's like, she was in my office. And I told you, she's adorable. So she's engaging. I can see him have built a rapport with her, you know. He quotes, "My thoughts remain with her loved ones during this devastating time. Like them, I am struggling to understand how this could have occurred. It is important to clarify that the surgery did not take place at my private practice, Tork Plastic Surgery, nor do I own or operate the independently owned ambulatory surgery facility where the procedure occurred." I love how he keeps saying, because he took a financial hit, because, like I said, the picture she has is in front of his office. He is also quoted as saying, "Rachel's surgery was completed successfully and without complications. Rachel was extubated and transferred to the recovery unit in excellent condition, where I personally updated Rachel's husband and brought him to her bedside, where she was awake, speaking with him, and recovering as expected ahead of her planned overnight stay for monitoring. Because Rachel was scheduled to remain overnight, her post-op monitoring was overseen by staff contracted by the independent facility, not by my practice. I was later notified that her condition had unexpectedly changed and immediately returned to assist with her care and transferred to Bethesda North Hospital, where I remained with the family and continued to offer support. I have discontinued all procedures at that surgery center. Out of respect for Rachel and her family and due to patient privacy laws, I will not comment further. I am heartbroken for Rachel Tussey and her family. My thoughts remain with her loved ones during this devastating time." He also writes that, like them, I am struggling to understand how this could have occurred. Her family has also made public statements on TikTok in which they say that nobody feels any kind of way about Dr. Tork. He's been at the hospital with us the entire time, and he has treated our family with compassion. We are not blaming him personally. He's going to take a hit, though.
I know, but that's really above and beyond to go to transfer to stay at the other hospital. Like that is really, I mean,
our issue is with the surgery center and the absolute incompetent medical staff that were working there. Tork has also said that in the complaint, so there obviously lawyers are involved. This is going to court. This poor husband, I know he just wants his wife. He's going to end up with millions. Tork said in the complaint that he was misled about the facility's capabilities and safety standards, and the situation that followed caused, quote, significant reputational and economic harm to his practice. The complaint alleges safety issues, unqualified nurses, a failure to follow proper protocol following an overdose, and subsequent cover-up. Journey Light declined to comment on the allegations when reached by NBC Chicago by phone. Associated anesthesiologists of Springfield could not immediately be reached for comment, as the company appears to have closed. Ooh. Like I said, when when Tork comes back, the anesthesiologist comes to him and is like, I should have been here. This wouldn't have happened. I was like, those are damning comments. Yeah. The legal team, Manny Ellis and Lane's legal team, on Tuesday filed a temporary restraining order to enjoin Journey Light and the Associated Anesthesiologist of Springfield's Inc. from further destroying, fabricating, or deleting evidence as it pertains to this case. So this facility is burning evidence so they won't get nailed for what they did.
Yeah.
So it sounds like they obviously overdosed her and didn't. If an anesthesiologist had been there, I think she probably would have come out of this.
Now, I thought it was said that they didn't have the PACU nurses didn't have ACLS.
I didn't hear that, but I've heard that, like, and we were talking about it, but I couldn't find stuff about the actual nurses. But go ahead.
Well, there's a difference. There's BLS, which is basic life support that everybody has to have.
It's your basic CPR that everybody on the street takes.
And then there's ACLS, which is more thorough. It's for like
advanced cardiac life support.
Yes, but so there's a reason why certain people in certain jobs have to have that. So BLS classes are open to everyone. But it is designed for healthcare clinicians and first responders, EMS, whatever. They teach you life-saving skills that you need to act quickly and effectively in a cardiac emergency, whether it happens at home, school, work, anywhere, the hospital. The training includes techniques like CPR, management of airway obstruction, rescue breaths, and the use of an automatic external defibrillator or an AED. And
Laura would know because she's a CPR instructor.
I am. And it also teaches you to deliver care to infants, children, and adults. You learn all of it. BLS training is taken by millions of individuals across thousands of healthcare organizations, EMS agencies, and the military training network. They are constantly updating the use current scientific guidelines. They change it.
BLS changes constantly.
But, there's new things come about. They change it so we can get better and stronger. But everyone at the hospital takes BLS. ACLS stands for Advanced Cardiac Life Support and is also referred to ALS or Advanced Life Support, but it's the same thing. It builds on BLS techniques with more sophisticated interventions and procedures. The goal is to stabilize critical patients who may have suffered a life-threatening event like cardiac arrest, acute coronary syndrome, or stroke. ALS courses offer an advanced certification designed specifically for healthcare clinicians like physicians, nurses, anesthesiologists, paramedics, respiratory therapists, dentists, and others who need to manage more complex
like ICUs,
emergency
ERs, recovery rooms.
Yep. ALS builds on the BLS training with techniques that include advanced airway management, IV access, medication administration, and electrical therapies like defibrillation, cardioversion, transcutaneous pacing. So both provide life-saving techniques during an emergency. However, the level of care differs, as does the training required and the equipment used and the setting. As part of the Red Cross ALS training, for example, healthcare clinicians will learn advanced life support assessment, as well as how to best manage respiratory emergencies, protocols for acute arrhythmias and cardiac arrest, acute coronary syndromes, and acute stroke within or outside of a medical facility setting. Nurses in the ED have ACLS. Nurses in the PACU have ACLS.
They have
Nurses
to.
in
You
the
cannot
ICU
work.
Have ACLS. They have to. They know those algorithms for the drugs and all. Like, you have to, because you're an advanced care setting. So you have to
because you're taking patients ICU, ED. You never know what's coming through the ED. That's number one. So they have to have it. ICUs, these patients are critically ill. PACU, they're all been anesthetized in some way, and the people's respiratory functions are going to decrease.
And you're giving these drugs,
right?
That can cause
but it sounds like
arrest.
she didn't even have BLS if she wasn't getting a seal on the ambu bag.
I mean, maybe she just hadn't done it. I'm assuming she had a BLS.
Yeah, but and let alone if there had been bleeding complications. Like, it doesn't sound like. So I'm quarterbacking here, Monday morning quarterbacking. I don't know what happened. It doesn't sound like it's good for these nurses.
No.
I wonder what their qualifications were to work in this place. I wouldn't work in any environment like that. I do my BLS. That's it. I don't know first thing about ALS. I'm the first to tell you that. I stay in the OR where there's professionals who do know that. I will support them all they need, but I am not running any of that. It's going to be interesting to see how this case plays out. I feel terrible for him. He's lost. You can see it. Like, he's doing a video, and it's you can hear the ICU. He's in the ICU with her. Yeah. So I think they had her on life support for 2 weeks before they finally pulled the plug. And you see her in the bed. It looks terrible. Yeah. She looks terrible. It's just, the whole situation's awful for plastic surgery. Yeah. It's like, not like,
it's not.
It was avoidable.
Right.
And I'm not saying don't get plastic surgery. I'm not saying I'm against it, but it was an avoidable surgery. And it's heartbreaking that she's gone.
Yeah, you're not, even when you're getting that, you're like, oh, what if the wound opens up, or what if I get an infection? You're not thinking like, what if I go into respiratory arrest afterwards, for a tummy tuck?
Right. She's over here thinking she's going to be on a cruise, living her best life. And, he's burying her. God bless.
That's awful.
So my heart goes out to that family. Really investigate where you're getting surgery. Yeah. Even teeth pulled. Like, make sure you're in a facility that has defibrillators, that has trained ACLS people in there. You don't want to go to a fly-by-night operation like Florida, Vegas, Beverly Hills. You got to be careful who's out there.
When I got my wisdom teeth pulled, my mother said to the dentist, well, what if her heart stops when you give her medicine? What are you going to do? And he was like, what? She's like, what if her heart stops? If you're putting her asleep, what if her heart stops? And he's like, no one has ever asked me that. And she's like, well, what would you do? And he's like, actually, we have a defibrillator. I do know how to use it. I am trained. And he goes, and next door are cardiologists, so I would get them to. And she's like, okay, all right. He's like, no one has ever asked me that, and they really should.
Let me tell you, when a patient crumps, yes, Brian, crump is a word.
It is a word.
It's scary as shit.
Yes.
Even residents will panic when they haven't seen it. And they're so focused on, like, there's no old school medicine anymore. Like, I had one anesthesiologist just like, there's no oxygen. The patient has no oxygen. I'm like, did you look at the patient?
Yeah, they're pink, they're breathing,
they're beautiful.
Yeah.
Look at your patient, but when it goes bad, they don't know what to do and they panic. So it's a scary situation because when a patient in seconds can crump on you. So let alone if you're in an environment where you have no backup, you have no help, you have no nothing. So that's our episode.
Yeah, investigate your people.
We're loving the emails.
Yeah, thanks.
Keep sending them in. We have a Father's Day episode all set. Now we need some more episodes. So help us out here, okay? Give us some good stories. Anything you hear, know, see, let us know what you want to hear. We love hearing from you. Yeah. Enjoy the beginning of summer. Yay. And we'll see you soon. Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.